This is Brian Wormers recording a lecture about the care of patients with eye and vision problems for medical surgical nursing at the University of Sioux Falls. So we'll talk about some of the common problems of the eyes and some of our interventions for that, as well as safety considerations. So blepharitis, caused by dry eyes, you get some scaling, and it can cause bacterial infection with this one. Realize that we've all got bacteria growing on our skin, but this is just kind of an over production of it, and it's causing complications. So oftentimes it's around the eyelids and the edges of this, causes some redness, burning, irritation, and you might see some seborrhea, so that's these kind of little things, the skin flaking off into there. Controlled with warm compresses, moist compresses, followed with some scrubbing of like a diluted baby shampoo. Avoid rubbing the eyes as much as possible because it just tends to make it worse. Entropion, so turning inward of the eyelid, causing the lashes to rub against each other. So this can be caused by spasms or trauma. Otherwise, it could be a loss of tissue support, and it causes those eyelashes, like I said, to rub on that eye, and that causes lots of irritation, redness, and swelling. Can have a correction of this with repositioning the eyelid. Otherwise, a lot of eye drops, or even patching the eyes to try and strengthen up the muscles and that tissue support is an option with this. So opposite of that is ectropion, so turning outward of the sagging eyelids. Once again, lacking muscle or connective tissue. More common with older people. So with this, you can get drying of the eyes and cornea, especially as you get decreased washing and it's not covering the eye as much. So oftentimes we are doing re-wetting drops with this one, and if push come to shove, surgery to restore that proper lid alignment. So here's just a good optic of it. So a normal eyelid, you might get ectropion or entropion, and both of those can cause complications, of course. Hordeolum, so this is a sty, and so you get red, irritated. It's infection of that sweat gland or sebaceous gland. Treatment, warm compress, antibacterial ointment with this. And if we get that off the site and into the eye, realize that ointment can cause some vision things. We do have to be careful with that. Chalazon, so it's kind of like that, but more swollen, bigger, reddened, and it's on the inside of the eyelid. Causes some eye fatigue, light sensitivity, and excessive tears. So same thing, warm compresses, followed by ophthalmic ointment. And if it gets severe enough, you can do surgery. Conjunctivitis or pink eye. So this could be, by definition, this is just irritation and inflammation. But it can be viral, it can be bacterial. And of course, if it's bacterial, then we're going to treat with antibiotics. So it's not of the sclera, but what you're seeing is redness of your conjunctiva, and then exudate oftentimes. So things we want to teach on is, if we're giving antibiotics, make sure that we give that. We don't want to touch the vial up against the eye, because then we can contaminate the vial. And then good hand hygiene with this. Trichomas, so this is often caused by chlamydia, and it's one of the most preventable diseases that there are, especially in third world nations. So when babies are born and stuff like that, we do give like some silver in their eyes, and that's to prevent chlamydia from causing trichomas. So we can do this, give antibiotics orally or eye ointment, and then try to prevent this is our biggest thing. So I have seen this still being given, even though it will say that it's not as effective, and so your eye drops are probably more effective. Corneal disorders, so this could be the simple things such as hyperopia and myopia, so that's farsighted, nearsighted type of situation. That can be corrected with glasses, contacts, or surgery. Otherwise, it could be other things related to irritation, infection, ulceration. Signs and symptoms could be reduced vision, pain, photophobia, and secretions. And so it can affect vision, so of course we want to work on this and fix it. Treatment can include antibiotics, antifungals, antivirals. Try to avoid makeup, try to avoid anything that's touching those eyes until we heal that infection. Keratoconum, so instead of having a normal shaped cornea, you're getting a cone shaped one, and as you're going through that lens, realize that this is going to impact the vision of that. Treatment wise, keratoplasty, so removal of some of that corneal tissue, replace it. It could either be a human donor cornea, or they're fixing it and shaping it. So oftentimes this is a regional anesthetic, and it's a same-day procedure. Corneal transplant, so taking part of the cornea out. So if you've got disease and it's not clear, you can put a new one in. Can have a complete eye donation, that's pretty rare, but corneal tissue can be from donors. With any donation, we want them free from infectious disease or cancer at the time of death, and that's for all donations. For potential eye donors at death, so if you've got a patient that is meets brain death criteria, those kind of situations, and it's going to donate eyes, keep the head of the bed up, provide eye drops as needed, and then close those eyes and put small eye packs on just to try and maintain that tissue. Any of the donor services will help you out with that, and we'll run that. Cataracts is clouding of your vision, and so this is blurring of the lens. So clouded lens, and then of course your image is going to be distorted on the back of this. Can be from lots of different stuff. Trauma, diabetes, and hypertension are some of the main causes of this, though. More common as you get older. So there are some age-related cataracts, but realize it can happen at any age. Can do surgery for this, trying to clear that up, break down any things within that cornea. And hopefully that clears this up and allows you to have good vision with that. So afterwards, we're going to try and protect that. Might keep it patched for a little bit. We're going to look for signs and symptoms of complications, such as pain, discharge, swelling, vision, those type of situations. And then of course we're going to use eye drops, keep that moist, and pain medications as needed. Glaucoma is an increase in the ocular pressure. This can occur slowly or very rapidly. And we'll talk about that here in just a little bit. But what happens then is with that increased pressure, you're going to get atrophy of the optic disc, and it's going to include or obstruct your vision with this. And so signs and symptoms: headache, nausea, vomiting, halos, blurred vision, and you're going to lose peripheral vision. Open angle is probably most common. It's asymptomatic early on. That's why we're doing the pressure checks whenever you go to the eye doctor. So this is slow, and what's going on is that you just gradually increase your inner optic pressure. So as opposed to your angle closure or narrow angle, this is a rapid emergency type of situation. This is occurring within less than 24 hours. Patients usually do not do good with this because they're having vision changes, nausea, vomiting, headaches, and this is an emergency. Otherwise, it can become a permanent type of situation. Therapy for this can include different drugs, so we're going to constrict the pupil and do a good assessment of this. We can try and reduce the production of aqueous humor within that eye from some of these different classes. So prostaglandins, adrenal agonists, beta-adrenergic blockers, cholinergic agonists, and carbonic anhydrase inhibitors. So I'm not expecting you to know the 5 different classes for this. But realize it's going on different pathways trying to decrease production of the aqueous humor. So education-wise on this, so talking about how to give these meds, when to give these meds, and why we're giving these meds. Macular degeneration, so that the area of the central vision deteriorates, and so they're losing their central vision on this one, as opposed to their peripheral vision with glaucoma. So with this one, the rods and cones die, and then that causes some blurring and distortion of the vision, and eventually leads into all central vision loss. So with this one, realize that they're going to keep their peripheral vision, and so we're going to have to do things like, get them to look at their peripheral vision and use that in their day-to-day life. So we try and slow the progression down as much as possible. We can get retinopathy from a couple of different things. Also, we can also get hypertensive retinopathy. I've seen this related to increased intracranial pressure from head trauma or different stuff like that. But prolonged hypertension can cause this as well. And so the arteries narrow and take a copper wire appearance when you look at it. I'm not expecting you to be able to see this with an ophthalmoscope, but realize this is what they'll say. So nicking in the blood vessels occur, and then you get lack of perfusion there. You might even get some areas of cotton wool spots. These are hemorrhages, and that's just leaking out. And so with this, you're going to get headaches and vertigo. Another type of retinopathy would be diabetic, and this is kind of the opposite. So you get blood vessel complications, of which you're not getting good circulation there, and those vessels will narrow. And so oftentimes you're seeing history of diabetic retinopathy throughout the whole body. But realize this can happen specifically of the eye. You get microaneurysms with this and poor perfusion. Treatment can include lasers, but what we really try to do is just control the diabetes as good as possible and work that route. Trauma can involve a lot of different things. So hyphema, what you're seeing here is just blood in the back of the eye, and so it's obstructing. But I mean, you can be very creative with a lot of different types of trauma that you might see related to motor vehicle accidents, sporting events, fireworks, etc., etc. So you're going to see bruises, contusions, abrasions, lacerations, foreign objects, penetrating images, retinal detachments. All these are emergency type of situations in which you want to treat, so you limit long-term complications of this. With all of these type of things, realize that you can have reduced vision, and with that reduced vision, that there's a major safety issue. Think about falls, thinking about medication errors, etc., etc. So with this one, we do have to use adaptive items with this. Have familiar settings, try and orient them, especially if they're in a new room or a new situation. Help them with ambulation. Make sure that the rooms are clean, picked up, free of debris or tripping hazards. We do want to promote self-care and independence as much as possible, but we do have to keep them safe as well. That concludes this lecture. If you have any questions, please contact me.